I'm sure you both are as excited as I am to be at the point where we've just approved our strategic plan, especially when you think of everything that we've done within the past 2 years to get to this point. I know we started in December of 2019, looking at our national priorities, then moved on to our research agenda, and then finally approval of our strategic plan.
And what's so incredible about this process, to me, is that we did this during the pandemic. This entire process essentially was completed throughout the pandemic. We had our first meeting of the Strategic Planning Committee in March of 2020, weeks into the declaration of a worldwide pandemic. And it was so reinforcing to see the willingness of stakeholders, of patients, community groups, clinicians, patients and nurses to participate in this process. And particularly in the beginning with the national priorities. The national priorities we ended up with bubbled up from stakeholders. It came from those who've been involved with and interested in our work over 10 years. And the board is so pleased and proud of the way the priorities ended up. And I think in particular, proud of the fact that this wasn't board generated. This was stakeholder generated, telling PCORI what was important and what we ought to be thinking about for the next decade at least.
I think our job was really to curate the process and to let others tell us the direction that PCORI needed to be moving in towards. And I know, Nikayla, that you were really at the forefront of driving that stakeholder-driven process.
Well, you know, it just exemplified for me the passion and dedication that those that surround PCORI have for the mission of PCORI, and to really help them in terms of thinking about how healthcare decision making could be much more informed, and that in this day and age with where we are at PCORI, the landscape for health and healthcare has changed so much, that the stakeholders just, I think, felt a responsibility to be able to provide that level of input that helped us map out that future for PCORI that would rise to the occasion of meeting these changes in the landscape that we're just witnessing on a regular basis, really unprecedented scale.
And in spite of the changes in the world and in the landscape, our vision remains the same and our mission remains the same, which I think is a real testament to the thought that went into creating a vision and mission for PCORI as a consequence of our mandate to serve the people of this country.
Well, when you think about how much PCORI has changed in the last 10 years and how much the world has changed, it is gratifying to see the way in which our mission and vision has endured. And I'm really excited about our opportunity to move us ever closer to realizing both, given the platform that we've already built and our new strategic plan.
And move us further along the continuum from doing research, generating evidence, and having ultimate impact on people's health and people's lives and communities.
I think that's what's really critical in this plan, is that it focuses on outcomes. And we've really moved to thinking about the outcomes of patients and caregivers and others that are really important for them to reach a level of optimizing their health as much as possible. And I think that's a real advance in terms of building on a strong foundation of the early work at PCORI to now having that opportunity to see how we can take that research and the research results forward for health impact.
And I think as an organization, PCORI has a lot more confidence in its competence in the resources it has to deploy for this. The ability to conduct comparative clinical effectiveness research, engagement, a very deep and enduring investment in engagement with stakeholders, communication, a very strong base of communication, dissemination, and then now increasing investments in implementation and funding efforts to implement the results of our research.
What's also really exciting about the plan is that it represents all of those elements in a much more integrated and holistic approach, and bringing as well the research infrastructure into that holistic approach, and recognizing that all of these streams that we've been working on at PCORI integrated together can take us that much further. And I think that's an incredible thing that both our stakeholders envisioned here and the board really just were emboldened by in terms of thinking about these next steps.
No, I agree completely. I've heard our strategic plan referred to as, bold and ambitious, and it is both of those things. It needs to be. Our healthcare system is broken in so many ways, and I think PCORI really offers an opportunity to help us begin to move in the right direction when it comes to health equity, when it comes to making sure that we're answering those patient-centered comparative effectiveness questions that are so critical to helping patients and caregivers and clinicians make decisions at the point where those decisions are really important. But the other reason why I am really confident that we're going to be successful is because of the infrastructure, but also because we are not doing this alone. We will be working with all of the stakeholder groups who helped us develop this plan to begin with, to implement. I mean, the two words that kept resonating in my head over the last 2 years were innovation and impact. And we heard over and over again from all of our stakeholders how important those two key concepts were. And I am really excited about the opportunity to continue to work with these amazing people and associations and groups as we move forward in this next phase.
I think it was very gratifying for the board that this process also created a very important period of self-reflection that I think enabled the board to see that this next phase is about building on a foundation rather than throwing everything out the window and starting over, and that it's a real testament to the strength of that foundation, that the next phase of this work is in fact building on a foundation, and that we do have a lot of partnerships that are the result of a fair amount of work on building those relationships, but there are also opportunities for new partnerships and different partnerships.
Absolutely.
As we really, we've talked about at the board, moving from institution-based research to community-based research, and melding the strengths of communities with the strengths of institutional researchers to build a better research process.
Well, there's something that comes to mind as you say that, and that relates to what I think the plan really articulates well, is that when we start to think about health and focus on health outcomes for patients, we no longer can just focus in a clinic. We actually have to get outside the doors of the clinic and think about those other determinants of health, and that requires partnerships. And so we have this very, I think, a unique opportunity to leverage the foundation of partnerships to help us in thinking about how we can inform intervention strategies that actually will impact health outcomes where people live, work, learn, and play. And that's just an exciting step forward for our work.
And over the last 2 years, the clinics were closed. Clinics were closed, the hospital beds were filled with patients with COVID. And so it made very real the notion that health happens where you are.
Right.
Not where your doctor is. Health happens where you are, and wherever that is, there are questions about what do I do now and what will work best for me, and that needs to be the focus of our work going forward.
Yes. I think it's that same health and healthcare landscape that also really pushed us to think about the issues of health equity and diversity, equity, and inclusion in the plan, and just the realities of what we saw with the pandemic and the disproportionate impact in communities of color made us realize that if we're going to have an equitable health outcome for everyone in this country, that we were going to have to focus on those social determinants of health and those other factors that influence health. And I'm proud that the plan doubles down those efforts and really focuses on diversity, equity, inclusion, not just in healthcare delivery, but also in the conduct of health-related research.
So, Nikayla, what's next as we think about how we move this innovative, bold, ambitious plan from, we want to make sure it doesn't just sit on the shelf. What are your thoughts about how we begin to convert this very elegant plan into action?
Well, I'm really glad that we had this approach where our stakeholder community helped to bubble up the themes that are incorporated in the plan, because that's exactly where we go next. We go back to our stakeholders, and in our plan we have national priorities for health, we have a research agenda, and now we have to get down to those specific topics that we're going to focus on that stem from that in our research project agenda. And the process to set that project agenda requires ongoing input from our stakeholders. So we're fortunate to have that deep and passionate connection with a lot of important individuals and organizations that are part of this greater healthcare community, and they're going to help guide us with these next steps. We've certainly heard a lot through the input that we've gathered thus far, so we've had a head start, so to speak, in terms of thinking about this implementation. But we certainly can't do this work alone, and look forward to working with our stakeholders on these next steps.
We have very interested advisory committees, PCORI's advisory committees, and ambassadors who feel like they have a real stake in helping us move this plan from paper to execution.
And one of the things that was really exciting to me is in reading over all of the comments that we got from just such a diverse group of stakeholders, is many people not only gave us their thoughts regarding our strategic plan and what should be included, but also, you know, they had suggestions for how we might move forward. So we already, I think, have the beginning of a roadmap.
Indeed we do, and I think that is a great place to leverage that to get started on things. But you know, there's a component of what we want to do in this strategic plan, and that's being really responsive to emerging needs, to changes in the health and healthcare landscape. And as those things emerge, it's really that stakeholder base that's going to be our guide in terms of how we move forward. Our patients, or the stakeholders that are around us, they're the guides for what comes next.
You know, it's interesting because for so many years since PCORI started, we keep hearing, you know, better, faster, you know, less expensive, and that's hard to think about, especially if you are used to the more conventional ways in which science moves forward. But I think what we've learned from the pandemic is you can do it faster and better. And I know that we're planning to incorporate a lot of the lessons learned, and that is the gift that of the pandemic, is that as we, and the timing of it occurring, you know, of us developing our strategic plan during that time period, is that we have, I think we've learned a lot about execution as in the plan development phase.
And we've learned that urgent needs require an urgent response, and we're able to pivot and actually figure out how to do that, and accelerate what had been routine processes for generating research.
It's so exciting.
It is, and that innovation that you talked about early on, that we heard all the times where we were talking with our stakeholders and gathering input, I think the innovation was about what PCORI can do, as well as about how we do it. And so we can really take that home in terms of our next phases of implementation. It is an exciting, a bold, ambitious plan that's going to guide our work for the next several years. But as you said, it's not static, it's evergreen. And it's this ongoing process of working with our broader healthcare community that's going to keep the plan alive.